Why can't you lower your blood sugar without medication? This video will provide the answer. Surprisingly, conventional solutions don't always work. We debunk myths and offer practical advice on quickly lowering blood sugar levels. And most importantly, how to sustain this effect long-term. In this video, you'll learn how does diabetes develop, how can you protect yourself from it, how to tell if your blood sugar has risen, what blood sugar level is dangerous, and why doesn't it drop, why should diabetics eat eggs and lemons, what's the issue with diabetes medications, how to quickly lower blood sugar levels, when does burdock help, and at the end of the video, an amazing bonus awaits you. A recipe from the Soviet Dr. Numivakin. How does diabetes develop? Often, you hear the opinion that diabetes is an incurable disease. This belief is based on a lack of understanding of the nuances of this condition's development. There are two types of diabetes. Type 1 diabetes is an autoimmune disease in which the body destroys itself. In this type, the immune system destroys the cells of the pancreas, resulting in insufficient production of insulin, the hormone that regulates blood sugar levels. The main cause of this type of diabetes is genetic predisposition. However, it can also occur due to infections and other environmental factors. Fortunately, this occurs rarely. In adults, type 1 diabetes develops in exceptional cases. The main cause of type 2 diabetes, on the other hand, is lifestyle and dietary habits. Genetic predisposition can also play a role, but excessive carbohydrate consumption, low physical activity, and obesity are more significant factors. Can diabetes go away on its own? Surprisingly, such cases exist, such as gestational diabetes, which develops in pregnant women due to hormonal changes, as well as in cases of sudden deterioration in pancreatic or kidney function. In these situations, blood sugar levels return to normal after treating the underlying condition. How to protect yourself from this ailment? In advanced stages, diabetes treatment often involves daily insulin injections. However, it's possible to avoid reaching such a state, even when the disease has already manifested. It's even better and simpler to adhere to the requirements for preventing this condition. One of the most important requirements is controlling your own diet. Firstly, it's necessary to reduce carbohydrate intake. Each food, depending on its sugar content, has a glycemic index. The lower this index, the safer the food is for diabetics. Secondly, it's important to monitor the intake of animal fats. It's especially crucial to avoid frequent consumption of processed byproducts. Thirdly, consuming an adequate amount of quality protein is important for diabetes. Include lean meats, nuts, seeds, and legumes in your diet for this purpose. Fourthly, consuming fiber is also an important factor in maintaining normal metabolism. Therefore, eat plenty of green vegetables, as well as fruits with relatively low sugar content. The fifth most important factor in preventing and treating diabetes in its early stages is physical activity. There are studies showing that maintaining daily physical activity and moderate body weight significantly slows down the progression of the disease. How to tell if your blood sugar level is high? There is a whole group of rather unpleasant symptoms that indicate high blood sugar. Primarily, this manifests as increased appetite and thirst that cannot be relieved even by consuming enough water. There are other symptoms: abnormally rapid weight gain or loss, skin peeling and excessive dryness, poor wound healing, decreased body temperature and sweating, frequent urination urges, significant decrease in libido, frequent elevation of blood pressure, dental problems, unpleasant breath odor, kidney and intestinal dysfunction. These signs are observed in the early stages of diabetes. Ignoring them will lead to metabolic changes in the body, making life much less comfortable and healthy. What blood sugar level is dangerous? Monitoring blood sugar levels is important even for completely healthy individuals, let alone those at risk of diabetes. For children, the normal blood sugar range is between 3.5 to 5.5 millimoles per liter, and for adults, it's between 3.3 to 5.9 millimoles per liter. Throughout the day, Blood sugar levels can fluctuate within a 10% range, which is perfectly normal for some groups of people, including diabetics, athletes, and those with serious liver conditions. Glucose concentrations in the blood can increase up to 8 millimoles per liter without significant symptoms. However, with further increases, serious acid-base changes occur, leading to the symptoms mentioned earlier. Without prompt action, this can progress to a comatose state, where the person is unresponsive to stimuli. If you monitor your sugar levels and consistently find them ranging from 5.6 to 6.9 millimoles per liter, consult a doctor for advice, as this indicates prediabetes. What do diabetics need? Every doctor, upon diagnosing diabetes, prescribes a strict diet for the patient. It requires limiting the intake of carbohydrates and fats. Fat restriction is explained by its role in cholesterol accumulation, which affects carbohydrate metabolism. Adhering to this diet comes with some difficulties. Firstly, not all sweet products have the same glycemic index. This index is considered crucial for assessing the impact of products on insulin production. Secondly, restricting fatty and carbohydrate-rich foods leads to a decrease in caloric intake. It may be challenging for individuals, especially if they are accustomed to calorie-rich diets. Moreover, diabetic patients need a complete set of vitamins. Fruits are rich in them, but many also contain significant amounts of sugars. How to resolve this contradiction? 2 products can help solve these problems: lemon and eggs. Lemon is one of the few fruits with a low glycemic index, just 15 units, and diabetic patients are allowed to consume products with an index below 50 units. Additionally, lemons are rich in vitamins, macro and micro elements. Due to its composition, it enhances resistance to infections, crucial for anyone but especially for diabetics with weakened immunity. Lemon also helps remove excess cholesterol, improves vascular health, and lowers blood pressure. All of these make it an indispensable tool for regulating metabolic processes. Why do diabetics need to eat eggs? The main benefit of this product lies in its ability to stimulate insulin production. Plus, eggs contain no sugars and are rich in beneficial vitamins. They regulate the gastrointestinal tract and eliminate toxins. However, eggs are quite calorie-dense and contain a certain amount of fats. Therefore, it's necessary to limit the amount of eggs consumed. The daily norm for an adult is 1 to 2 eggs. By the way, in terms of vitamin and mineral composition, it's better to prefer quail eggs. They bring more benefits than chicken eggs. But chicken eggs also positively affect pancreatic function. How do eggs and lemon work together? The combined effect of these products solves several tasks. Firstly, it improves the processing and absorption of cholesterol and glucose. Secondly, it saturates the body with vitamins and minerals. Thirdly, it cleanses the intestines, pancreas, and liver from toxins. Fourthly, it strengthens the immune system. Therefore, even representatives of official medicine sometimes advise using these products together with pharmaceutical drugs. Additionally, eggs help with quick recovery after fractures due to their high calcium content, and lemon with egg can improve skin condition. However, to achieve the healing effect, it's necessary to prepare folk remedies from eggs and lemon correctly. How to treat with egg and lemon? For diabetes, use the following recipe. Wash the lemon, cut it in half, and squeeze the juice into a separate container. Usually, 1 lemon yields 50 milliliters of juice. In another container, break 1 egg. If you want to replace chicken eggs with quail eggs, you'll need 5 of them. Add lemon juice to the eggs, mix until homogeneous, and consume the resulting mass half an hour before meals. Take the egg with lemon once a day for 3 consecutive days. Then take a 3-day break and repeat the intake. The entire course of treatment is 1 month. After a short break, if necessary, the course can be repeated. The face mask is made from the white of 1 egg, a tablespoon of lemon juice, and the same amount of aloe vera juice. Beat the egg white with a whisk, Then add the remaining ingredients and mix. Apply the mask for 20 minutes, then rinse off. It cleanses the face well but may slightly tighten the skin. So after using it, apply a moisturizing cream. Who should not use this remedy? It should not be taken in case of allergies to lemons or eggs, kidney diseases, stomach and intestinal diseases, very high cholesterol levels, and sharp glucose spikes. In such situations, it's necessary to consult doctors, as lemon acid can irritate the already damaged stomach mucosa, and the fat in eggs may be contraindicated in case of critical cholesterol elevation. How to lower blood sugar levels? There are 3 common and very dangerous myths about lowering blood sugar. The buckwheat myth. Many believe that buckwheat helps lower sugar levels. In reality, buckwheat is a slow carbohydrate and, like other cereals, can actually raise blood sugar levels. To effectively lower sugar, it's better to increase consumption of quality protein, low-carb vegetables, and healthy fats, while reducing carbohydrates like buckwheat. The fasting myth. Some believe that fasting can be beneficial for lowering sugar. However, during fasting, the liver begins to actively release glycogen, which can lead to a sharp increase in sugar levels. The fat myth. Many consider fats harmful. However, not all fats are the same. Animal fats like butter or lard can raise cholesterol levels when consumed excessively. Meanwhile, plant oils like olive or cedar are beneficial for health and do not affect cholesterol. Fish oil, rich in omega-3, helps lower cholesterol, strengthen blood vessels, and has anti-inflammatory properties. Accordingly, to effectively maintain normal blood sugar levels, it's necessary to limit carbohydrates and focus on healthy fats, especially plant oils and fish oil. Quickly lowering blood sugar levels. There are several simple folk recipes that you can use to quickly and, most importantly, safely lower blood sugar levels. Let's look at 3 popular methods. Recipe #1. Take 1 tablespoon of ordinary buckwheat groats and crush them thoroughly with a mortar and pestle or using any available means. Pour the crushed buckwheat with 200 milliliters of kefir, warm to room temperature, and leave it overnight. Drink the resulting solution in the morning, and make a new one in the evening. Repeat the procedure daily if your sugar remains high until its level drops. Recipe #2. Take 1 tablespoon of flax seeds in powder form. Pour the seeds with 200 milliliters of boiled water and let it steep for 40 minutes. Squeeze the juice of half a lemon into the prepared infusion. Stir it well and drink without straining in one go. If necessary, make and drink the infusion the next day if you feel that your sugar is approaching the upper limit. Recipe #3. Pour 8 to 10 bay leaves with 1 glass of boiling water. Transfer the infusion to a thermos and let it infuse for 24 hours. Drink 1/4 of a glass 3 times a day, half an hour before meals, without straining. Take the infusion in courses for 3 to 6 days. During this time, elevated blood sugar will normalize. What to do if the disease progresses? In situations where diabetes is already developing and dietary changes alone do not yield results, a tried and tested German remedy can come to the rescue. Nettle tea. To prepare it, you'll need half a liter of water and 25 grams of nettle roots. Pour boiling water over the nettle roots and simmer for a couple of minutes on low heat. Then remove from heat and strain. To get rid of the slightly bitter taste of nettle roots, add berries or spices to the tea according to your taste. Drink the tea throughout the day, thanks to its content of flavonoids and phenolic compounds. Nettle can lower blood sugar levels and improve overall immune function. How will burdock root help diabetics? Pay attention to scientific research. Animal experiments have shown that daily consumption of 200 milliliters of burdock juice extract led to maintaining a stable insulin production level and accelerated sugar metabolism in the body. How to apply burdock? To address digestive issues and strengthen the immune system, take 1 tablespoon of crushed burdock root and steep it in 300 milliliters of boiling water, letting it infuse in a thermos for 2 hours. Take this remedy 3 times a day before meals. It's important to note that this remedy doesn't work instantly. For systemic conditions, it may be necessary to drink burdock root juice or infusion for 6 months to a year. For cholecystitis and liver diseases, the course is significantly shorter, 7 days, but 3 courses should be repeated with a week interval. There are almost no contraindications for taking burdock, which is why the Japanese consume its root in large quantities. Pregnant women should abstain, and its diuretic properties should be considered cautiously when taken concurrently with other diuretics to avoid overstimulation. A simple method for controlling diabetes without pills and injections. There is an affordable and easy-to-use method for combating high blood sugar levels available to everyone. Apple cider vinegar. It is made from fermented apple juice, which turns into ethyl alcohol, and then into vinegar thanks to acetic acid bacteria. The main advantage of apple cider vinegar is its ability to improve insulin sensitivity. For people with type 1 diabetes who have insufficient insulin, apple cider vinegar helps enhance the action of insulin. For those with type 2 diabetes where insulin is ineffective, acetic acid helps lower blood sugar levels by counteracting insulin resistance. It is recommended to dilute 2 tablespoons of vinegar in 300 milliliters of water and drink it throughout the day before meals. It's important to drink this mixture through a straw to avoid damaging tooth enamel. With regular consumption of apple cider vinegar, blood sugar levels should be monitored, and if necessary, medication doses adjusted, as it can significantly lower this indicator. And remember, only natural, unfiltered, and unpasteurized apple cider vinegar is suitable. This one thing can boost your fight against diabetes. Find out what it is. And now for the promised bonus. We're talking about a method of lowering sugar that many haven't even heard of. Hydrogen peroxide inhalation. Don't be surprised by this unconventional way of affecting blood sugar. This method was recommended by the famous Soviet doctor Ivan Neumann. Doing such inhalation is very simple. Fill a basin with hot water. It should be hot enough to produce steam, but not to scald the airways. Add a teaspoon of 3% hydrogen peroxide to the basin and inhale the steam for 10 to 15 minutes. To make the inhalation more effective and prevent the water from cooling too quickly, it's advisable to cover yourself with a sheet during the inhalation.